All right. Good afternoon, everyone. I'm Heather McPherson, President and CEO here at Women's College Hospital. To begin, we would like to acknowledge that the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Thank you all for being here today. I would especially like to welcome Prime Minister Trudeau, Minister Freeland, and Minister Ian, all who have been long-standing supporters, allies, and advocates of Women's College Hospital. Women's College Hospital was founded 140 years ago as one of the only places for women to practice medicine and receive care. Today, our rich history of health equity remains at our core. It is the driving force of the programs we create, the care we are proud to offer to our diverse communities, and the culture of inclusivity that we deeply believe in. Over 50 years ago, Women's was the first hospital to establish a walk-in birth control clinic, known today as the Bay Centre. Not only did the Bay Centre provide contraception and reproductive health care, it also centered itself as a teaching clinic for physicians, nurses, social workers, and pharmacists. And while our programs and services at the Bay Centre have evolved in the last 50 years, at its core, it remains a safe haven for women to access the care they need, and is staffed by a team who all believe, like we do, that access to reproductive health care is everyone's right. Today's announcement is a monumental moment in the evolution of our healthcare system that has not been reimagined in this way since the inception of universal health care. We are honored that the Prime Minister and his colleagues chose Women's College Hospital, timed with International Women's Day, to share this news and what it means for Canadians from coast to coast to coast. And now it's my pleasure to welcome the Honourable Marci Ian, Minister for Women and Gender Equality and Youth.
Thank you so much, Heather. Hello everyone, bonjour à tout le monde. Merci Heather pour cette merveilleuse introduction. It is so fitting to be here at Women's College Hospital with our Prime Minister, with our Deputy Prime Minister, to speak about just how game-changing this national Pharmacare plan will be for women in this country. Fitting because Women's College is a place that breaks ground, new ground, and has done so, as Heather mentioned, for decades upon decades. I would be remiss if I didn't mention our former colleague, it's now colleague and friend, Carolyn Bennett, who broke a lot of ground here with the teams here, who is a legend here, and who shared with me stories of that time. So proud to be on this hallowed ground. It was just a week ago that I stood alongside Minister Mark Holland to announce Canada's first national Pharmacare plan, a plan that will cover diabetes medication for almost 4 million Canadians and make contraception free for women right across this country. Here's what I need to tell you. Since last week, there has been an outpouring of support from women right across this country, every corner of it, different backgrounds. I am talking activists, I am talking medical professionals, young women, experts, all saying that this was the right thing to do, all saying that this is something that they had been waiting for. In the words of Kelsey MacDonald, and Kelsey is at the Society of Obstetricians and Gynecologists of Canada, she says, "This is truly historic for Canadian women. During the 30-plus childbearing years of a woman's life, they are spending money out of pocket on contraception. Your income should never be a barrier to accessing tools that help control your own future." We absolutely agree with Kelsey, which is exactly why full contraceptive coverage for every Canadian woman is part of the very first phase of the Pharmacare plan. We did this because we know how many lives will change. We did this because we know how many women today and in the future will benefit from this. We did this because it isn't right that people have to make decisions about which contraception to use based on the price and not based on what works for them and what's right for them. So with International Women's Day tomorrow, Let's celebrate the incredible women in our lives, the incredible women that were groundbreakers and continue to be in this facility. But let's not forget the generations of feminist activists that dreamed of days like today. Merci beaucoup. It is now my absolute pleasure to pass the mic to the Deputy Prime Minister, Finance Minister, and proud MP of University Rosedale, my friend, Chrystia Freeland.
Thanks, Marci. Well, thank you very much, Marci. I'm so delighted to be here with Marci, with the Prime Minister, with Heather, with the amazing team here at Women's College Hospital. The work you do here is so important, and I just want to start by recognizing that, thanking all the healthcare professionals across Canada, and just a personal thank you to the amazing people here at Women's College Hospital. This is really a special personal place for me because I gave birth to my first child at Women's College Hospital. And, you know, like so many women in Toronto, in Ontario, that means whenever I come here, I think of that moment when I became a mother here with the help of all of you. And so I just really want to recognize the role Women's College Hospital plays, all our healthcare workers play. They are at the center of so many of the stories that are the most precious stories in the lives of Canadians. And of course, the work you do here is quite literally life-saving. Women's College is where the simplified Pap test was developed, leading to more women getting screened for early signs of cervical cancer. It was the first hospital in Ontario to use mammography to detect breast cancer, literally saving lives every single day here. And Ontario's first sexual assault and domestic violence care center was opened here. Alors, vous êtes de véritables pionniers et pionnières de la santé des femmes au Canada. Et merci beaucoup. Merci beaucoup à vous tous. Vous êtes des pionnières de la liberté, du choix des femmes sur leur corps et leur vie, qui est tellement essentiel. Notre gouvernement le reconnaît et est là pour vous soutenir dans votre travail et pour soutenir toutes les femmes au Canada. En tant que gouvernement fièrement féministe, nous prenons la liberté de choix très, très au sérieux. That's why we launched our Canada-wide system of early learning and childcare in 2021. Because affordable childcare also means that women in Canada don't have to choose between having a career and having a family. And today, less than 3 years after we got started, childcare fees are down by at least 50% across Canada. In 7 provinces and territories, childcare costs just $10 a day already. Here in Ontario, this year, families are saving up to $8,500 per child. And, you know, that means a lot in terms of affordability for families who are struggling with the cost of living. It's helping our whole country in the fight against inflation by bringing costs down. And thanks to our early learning and childcare system, Canada's labor force participation rate for working age women in their prime years is 85.4%. That is a record, and it compares to just 77.4% in the United States. So early learning and childcare, it is a great social policy. It means so much in the lives of so many families. But speaking as finance minister, I want to say to you, it is also an excellent economic policy, which is adding to Canada's labor force, helping our economy to grow. Tomorrow is International Women's Day. And so just before I close, I'd like to pay tribute for a moment to Canada's pioneering feminists, to Judy LaMarche, Laura Sabia, et Monique Bégin, qui ont convaincu le gouvernement d'établir la Commission royale d'enquête sur la situation de la femme au Canada en 1967. The Feminists of Ontario, Morna Ballantyne, Martha Friendly, and Gordon Cleveland, they spent decades fighting for a universal national system of early learning and childcare, and their work, as well as the pioneering work of Quebec feminists, was what made it possible for our government to take the leap and establish a national system of early learning and childcare. I want to pay tribute to Emily Stowe, the first female physician in Canada and the founder of Women's College Hospital. What an amazing woman. And to her supporters who started the transformative work of this hospital 140 years ago. And to all of our mothers, our grandmothers, our great-grandmothers, whether they're alive or not, whose courage and confidence inspire us every single day. I want to say to them, to our foremothers, thank you very much. We stand on your shoulders. Merci encore à l'incroyable équipe du Women's College Hospital. Merci à notre chère collègue Carolyn Bennett qui a travaillé ici beaucoup, a travaillé pour les femmes au Canada pour plusieurs années. Merci à vous tous qui sont ici avec nous. Merci de vous battre nuit et jour pour les femmes et leur santé. Et maintenant, j'ai le grand plaisir à céder la parole à notre Premier ministre, Justin Trudeau. Monsieur le Premier ministre.
Merci, Chrystia. Merci, Chrystia, pour tout ce que tu fais, non seulement en tant que vice-première ministre et ministre des Finances, mais aussi en tant que fière députée locale ici. Je remercie Marci aussi pour tout ton leadership au sein de l'égalité des femmes et ton travail au sein de notre Conseil des ministres d'un gouvernement résolument féministe. And Heather, thank you so much for welcoming me back here. Last time I was here for an announcement with Dr. Carolyn Bennett, and it is a real pleasure to be back here today for this announcement, but also to say thank you to all of you, the extraordinary team here at Women's College Hospital. It has made such a huge difference in the lives of not just people across the GTA, but right across the country with your example, with your innovation, with your leadership, with everything that Women's College Hospital has done over the years. Since the late 1800s, when Dr. Emily Stowe founded Women's College Hospital and realized there was a need for a women's medical school in this country, this place has been a place of innovation, a place of equity and equality, and a place of care. And it's those values that suffuse everything that has been done here and continues to get done here that we're certainly drawing on as a government as we move forward with national single-payer Pharmacare starting in two specific areas. First is contraceptives, making sure that women right across this country can choose when they want to start a family, have power over their path, whatever their path is, and not have cost be a barrier to that. We know that affordability of prescription contraception is a real issue in this time of squeezed budgets on just about everything, and being there for women right across the country with this is something this government is committed to, and we're going to roll up our sleeves with the provinces. We're actually basing our approach on the BC model that led on this, but there's lots of work to do to make sure that everyone gets the right coverage right across the country. And on the eve of International Women's Day, I'm so glad to be here to make this point that women's health is health for everyone, and making sure we build a strong society where affordability challenges don't get in the way of the really important family planning that is every woman's right in this country. Second, we're moving forward on diabetes medications because we know that it's a huge issue faced by millions of Canadians, but diabetes is also a situation in which far too many people are having to make choices between putting groceries on the table or paying rent or paying for their medication. And when they miss medication, not only does it lead to much worse health outcomes for them and quality of life issues, but it ends up costing our medical system much more in serious consequences. So moving forward on Pharmacare for contraceptives and diabetes medications just makes sense in terms of not just being there for Canadians and making sure they have all the opportunities to succeed and have great fulfilled lives, but also countering the affordability challenges that we know Canadians are facing right across the country. D'aller de l'avant avec l'assurance médicaments, particulièrement sur les méthodes de contraception et les médicaments contre le diabète va avoir un impact positif dans la vie de Canadiens d'un côté de ce pays à l'autre. On est là pour aider les femmes à choisir quand et comment elles vont vouloir commencer une famille et ne pas avoir le coût de la vie interférer avec leurs choix et leurs plans. C'est un principe fondamental pour nous et c'est pour ça que je suis très content d'être ici aujourd'hui pour cette annonce. Je suis très content, encore une fois, de pouvoir remercier cet hôpital extraordinaire pour tout ce qu'ils font et ce qu'elles font depuis presque 150 ans. Et on va continuer d'être partenaire avec ceux qui livrent des soins de santé à travers le pays à tous les jours. We've made huge investments in healthcare over the past years. We will continue to step up to make sure that every Canadian gets the care they need. It's how you build a strong economy. It's how you build a strong future. And we're going to continue to be there for that. Merci beaucoup tout le monde. Thank you all.
Nous allons maintenant commencer avec la période des questions. We'll now start with the question and answer period. First question goes to Catherine Aylesworth from Global.
Hi, good morning or afternoon now. So 6 people were found dead in an Ottawa home. Are you able to provide any sort of reaction or comment to that?
Obviously, our first reactions are all ones of shock and horror at this terrible violence. We're expecting that the community reaches out to support family and friends, as Canadians always do, and we expect the police of jurisdiction to be doing the work and keeping us all informed of this terrible tragedy.
Thank you. How do you explain how GC Strategies, a 2-person Ottawa IT firm, received $100 million in federal contracts, and why was its security status only suspended yesterday?
Obviously, this is an unacceptable situation. We have significant questions, as do all Canadians, for the public servant processes that allowed for this to go forward this way. That's why there are ongoing investigations. There will be consequences and accountability for anyone found breaking the law. And we need to make sure that anyone, particularly who profited from a once-in-a-century pandemic where everyone was working hard to save lives and protect people, to line their own pockets or to profiteer from it, that there be consequences for them, and that's what we're ensuring.
En français?
Okay. Comme tous les Canadiens, nous trouvons que cette situation est inacceptable. On a des questions sur comment l'approvisionnement a fonctionné à l'intérieur de la fonction publique et on s'attend à ce qu'il y ait des enquêtes et des conséquences pour quiconque aurait brisé la loi. Le fait qu'il y a des gens qui ont l'air d'avoir profité de l'intensité du moment où on était là pour aider les Canadiens avec tout ce qu'on pouvait pendant la pandémie, c'est certain qu'il va y avoir des conséquences pour tous ceux qui ont été impliqués là-dedans.
Prochaine question à Radio-Canada.
Catherine Brulotte. D'abord, un document interne de la Défense nationale montre qu'il y a seulement un peu plus de la moitié de nos forces armées qui sont prêtes en ce moment à être déployées en cas de crise. Comment peut-on être perçu comme un allié crédible dans ce contexte-là et est-ce qu'on peut s'attendre à un signal dans le prochain budget?
Depuis 2015, à chaque année, on a investi plus dans nos forces armées. On a annoncé des investissements d'augmenter de 70 nos investissements dans nos forces armées parce que les femmes et les hommes qui servent dans nos forces armées méritent d'avoir l'équipement et l'appui nécessaire. Nos alliés à travers le monde sont tellement contents quand on a des Canadiens, des effectifs, que ce soit en Latvie, en Lettonie ou ailleurs. On est en grande demande et on va continuer d'être là comme partenaire pour l'OTAN, partenaire pour NORAD, où on a fait des investissements de 38 milliards de dollars pour les prochaines années pour moderniser la défense de l'Amérique du Nord. On va continuer d'investir pour s'assurer que dans un monde de plus en plus incertain, les Canadiens puissent se sentir en sécurité, mais aussi contribuer à la sécurité de notre planète.
En anglais.
Over the past years, every single year, this government has invested more in defense. We have laid out an ambitious plan of increasing by over 70% our defense investments over the years, and we're going to continue to make sure that the women and men of the Canadian Armed Forces have the tools necessary to step up. The world is getting more uncertain and more challenging, and that's why Canadians need to feel safe, but we also need to feel that we are doing our part to keep the world safer, to protect the world's democracies, which is why we're going to continue to be investing in our Canadian Armed Forces.
Suivi.
Et il y a une entente entre le gouvernement et un des deux, Michael. Pourquoi est-ce que c'était important de dédommager et est-ce que c'est une forme de reconnaissance d'une part de responsabilité du côté du gouvernement canadien?
Ce qu'ont vécu les deux Michaels en étant arrêtés de façon arbitraire par la Chine a été extrêmement difficile. On les a appuyés depuis les premiers moments et on les appuie encore dans le retour à la normale, dans une vie qui a été affectée profondément par les actions du gouvernement chinois. C'est notre responsabilité de continuer de les appuyer et c'est ce qu'on est en train de faire.
Mes collègues demandent en anglais aussi.
From the very beginning, we've been there to support the two Michaels who went through unimaginable difficulties being arbitrarily detained by China. We will continue to be there to support them. I think recognizing that no one should have had to go through that situation, that the decision by China to use them as pawns in geopolitical games was absolutely unacceptable, which is why we're continuing to support them and why we're actually working around the world on initiatives against arbitrary detention to make sure that no one anywhere gets used as a political pawn.
Next question goes to Omni News.
Hello, good morning. Chinese state media mentioned such settlement between Ottawa and Michael is the indication proving two Michael indeed engage in espionage activities in China. This seems to be contradictory to Canada's narrative saying that two Michaels' detention were arbitrary and unjust. So can I have your response to this?
The Chinese government arrested and arbitrarily detained two Canadian citizens, Michael Kovrig and Michael Spavor, for political reasons. There was absolutely no justification, no reason, no excuse for them to do that. And we have stood strong from the very first day in support of the two Michaels and gathering together supporters from around the world, countries around the world who called out the Chinese government for its arbitrary detention of two innocent Canadian citizens. The fact that the Chinese government thinks that because we actually believe in supporting and taking care of citizens who go through hardship as somehow proof for letting them off the hook just demonstrates the depths to which China does not understand what it is to be a rule of law country that takes care of its citizens.
Follow up.
Any follow-ups? No.
Next question goes to CBC.
If you can answer in English and French, please. Prime Minister Trudeau, will you be restoring funding to UNRWA?
The ongoing humanitarian crisis and disaster in Gaza is heart-wrenching for everyone. We know how important it is to get aid into Gaza to help families, the innocents, the civilians, the people who have been devastated by the past few months, facing starvation, facing instability and uncertainty. We know we need to continue to be there for them. At the same time, there are serious allegations being followed up by the United Nations, and we're going to continue to move thoughtfully forward, but our priority will always be being there to protect innocent lives. La réalité, c'est que la crise humanitaire qui se passe actuellement à Gaza est inimaginable. Et nous devons tous et chacun de faire tout ce qu'on peut pour soutenir les civils, les innocents qui sont pris dans cette situation horrible. C'est pour ça que nous avions été là et nous allons continuer de chercher à être là pour appuyer les gens. Oui, il y a des allégations sérieuses que les Nations Unies, sur lesquelles les Nations Unies est en train de faire des suivis, mais la priorité doit être la protection de civils.
And just a follow-up to my colleague's question about the armed forces, given the trio of polls this week, do you feel out of step with the Canadian public, which is growing increasingly worried about the state of the forces?
I think the Canadians know we're living in a world that is far more uncertain and insecure than it's been before. You just need to turn on the news to see geopolitical instability all around you. And Canadians understand that not only do we have a responsibility to keep our own country safe, but we have much to contribute to keep the world safe and therefore keep Canada safe as well. These are things that we have stepped up on, unlike the previous Conservative government that actually dropped military funding down below 1%. We have steadily increased military funding with a plan to increase spending by 70%, and we're continuing to step up, including with the modernization of NORAD, announced a number of months ago, with real investments that are going to keep Canadians safe and ensure that the women and men of the Canadian forces have the equipment that they need.
En français, please, s'il vous plaît.
Okay. Nous allons continuer d'investir dans nos forces armées parce que le monde est rendu plus incertain et les Canadiens se doivent être protectés, mais aussi savoir qu'on peut contribuer partout à travers le monde. L'ancien gouvernement conservateur avait baissé les investissements dans les forces armées à moins de 1% de notre PIB. Nous avons augmenté de près de 70% nos investissements sur les prochaines années. Nous allons continuer d'être là pour s'assurer que les hommes et les femmes des forces armées aient l'équipement et les ressources nécessaires pour nous défendre et pour défendre la démocratie à travers le monde.
Next question goes to Laura Stone from the Globe and Mail.
Hi, Prime Minister. We learned yesterday of the settlement with Michael Spavor. Did you also reach a settlement with Michael Kovrig, and can you provide any details of that?
I'm not going to get into these matters in terms of because of confidentiality issues, but of course. Canada has been there to fight for the two Michaels' freedom, and we will be there as they rebuild their lives.
Okay, thank you. And can you comment about some of the protests that we've been seeing across the country in relation to the Israel-Hamas war, but particularly in Toronto? I mean, you had experience with this last weekend where your event was canceled, and a lot of people were upset about that, upset how they've been. Toronto Police has talked about the hostility and confrontation between police and protesters now. What specifically is your government, if anything, going to do about this, or are these protests just allowed to happen in our country because it's a free country?
Well, first of all, nobody can remain indifferent to the suffering and the anguish going on in Gaza right now, this loss of civilian lives and the impact on Canadian families and people who are worried about their loved ones is entirely understandable. Canadians have a right to protest, absolutely, to make their anguish, their anger heard by other Canadians. That's important, and we will always protect that right. But when the protests turn to hatred or to acts of harassment, particularly against fellow Canadians, there's a line that's crossed. I've heard from too many members of the Jewish community particularly who are seeing their synagogues, their community centers, their neighborhoods protested, who feel unsafe in their own country. I know Canadians have very strong feelings about this conflict, and rightly so. There are horrible things that we are seeing. But it is not who we are to take it out on our fellow Canadians. Absolutely, there are things to be outraged about, things that people need to continue to protest about. But hateful or harassing behavior, particularly against neighbors, is not what we do here in Canada. And as that happens, or when that happens, I expect Canadians, including our police authorities, to act within the rules and within the law of making sure that everyone can always feel safe everywhere in this country.
Last question goes to CP.
Hi, Prime Minister. Just to clarify, since you mentioned before moving forward thoughtfully on UNRWA, can you confirm yes or no whether funding will be resumed to the organization? And if so, what has changed since last month when your government announced a pause on that funding?
We have ministers right now in the Middle East engaging on the ground with partners, looking at all the things that Canada can do and should do. We've been talking about airlifts lately. We need to get more aid into Gaza. We all recognize that. We're not making any announcements today, but we will continue to make sure Canada does the right thing in this situation and puts the protection of civilian life at the forefront of everything we do.
Follow up.
Given Israel has accused UNRWA of having a dozen employees who participated in the October 7th attacks, would any future funding from Canada to the organization be tied to conditions or reform?
When we began our investments in UNRWA after a previous government had suspended them, we put in significant conditions and assurances about where and how that funding was to be used. We will continue to ensure that the funding, any funding we get on humanitarian issues anywhere around the world is used to protect the most vulnerable. We will continue to look at this situation. We will continue to watch the UN as it looks into what's happening within this organization.
This concludes the press conference. Thank you, everyone.
Merci beaucoup tout le monde. Thank you all so much.